Christmas party. My boss was the one that with dengue and COVID. We, not knowing that he has COVID, he still mingled with us. I did not put on the mask. He did not put on the mask. That is how it was spread to me.
I drive through test and they come to our camp and less than 3 minutes we are off.
I invited a friend to a dim sum. That dim sum also I cough a little bit. And we you're in the same table, not much of distancing. So I think that I passed it to him.
The round table for 4 persons is quite a distancing. And yet it transmits, to him.
Back in the office, I had a chat with my colleague. He used to put on mask. I think I did not put on mask at certain occasion. Then Tuesday, he also contacted it. In the hostel, in fact, each block, I think it's about 60 or 70 people, all in different rooms, 4 floors in the quarantine center. There's no medicine being given. Second morning, they tested the blood, and then when the result was not good, they transferred me to the treatment center. The treatment center was better. Once we are there, we had another round of blood tests. Every 5:30, they wake us up. They will have tests, blood pressure, checking until about almost 8 because a lot of people, they test your oxygen level to your brain. So if you are below 95, then you're considered not good. And then they did X-ray for us and monitor our movement, our blood tests every day. In the quarantine center for 2 nights, I could not sleep. The pain was continuously building up. In the treatment center, the first 2 days was very bad. I could not sleep, cough, and all these things. But one thing I see that they are working very hard. They accept us at 12 plus and 3 o'clock, 4 o'clock, all this, They work non-stop. Relentlessly, they work. I really appreciate and thankful for all these people. The taste buds, it's not 100%. Now it's about 90. I feel not as strong as previously. I feel sleepy, easily tired. After about 3 or 4 days, I was still having a bit of cough and flu and nose block. I think I have taken things for granted. We have to do distancing, we have to put on masks. Because I did not do that, and I contributed to the passing on to my wife, colleague, friend, What about their multiplier effect? They can spread, We really need to take care, Avoid meeting together. We must be careful, vigilant, and take all the SOP and try to avoid as much social gatherings as possible. We really need to take care. Stay safe, stay at home until things improve, then we move on.
I can see the big picture is that we have to be responsible for ourselves. When we are responsible for ourselves, we are responsible for others around us. And we are protecting others around us, our community, our families, our friends, and all these things. The consequences will be bad and it can affect many. That's why we have to be very careful on our deeds, on our acts. Don't wait till when you are sick, then only you seek attention. Set a good example to our family, to our community. Be a responsible person. After I walk out from the center, the feeling is I'm free, I'm safe, I'm out of COVID. So to me, this type of freedom not easy to get. So stay safe and stay home and be a responsible person.
I think there were multiple factors that came to play. We did very well initially to control the whole COVID-19 situation. And then we started getting people coming back from overseas. There was the Kedah incident. Fortunately, there was an outbreak in Sabah, and we also did not quarantine those people who were coming back well enough. After about a year of facing this pandemic, people also got a little bit tired, too relaxed, too complacent with things, and probably that's when things start to rise again, the numbers in COVID-19. By now, most people should know it spreads usually by close contact, not so much airborne, but air droplets, which means saliva and any bodily fluids. Hence the social distancing of at least 1 meter, wearing face masks to prevent any of these bodily fluids from getting across to the other person. The most common symptoms are dry cough and fever, but they can have other symptoms, which is what we say viral-like symptoms. So you have body aches, headaches, sore throat. One of the key features, which is not always common, is they tend to lose their sense of smell. Sometimes if you met someone and it's a brief encounter, it may not spread within that short period of time. There are criteria that we look at to say that this person is a close contact. Generally, we say that if they have been together about 1 meter or less for at least more than 15 minutes in a closed environment, which means it's a room with no free flow of air, and if they're both not wearing face masks, those people are more high risk. So not to say that if you met someone with 5 minutes, mask off or mask on, you can't get it, but it's very much less likely. And when there are a lot of people who wear the mask, but they don't wear it properly, they leave their nose like this, or they wear it under the chin, that doesn't work. You need to cover the membranes inside the nose and the mouth. And to some extent, people try to cover the eyes as well, because these are the entry points. That person who is COVID-19 positive, I'm sure they would have made the report, and usually they will do contact tracing. That person who has close contact, as what I mentioned earlier on, can go to, Malay it's called Pusat Kesihatan Daerah, PKD, to one of the localities, and you can report that you have come into close contact. From there, usually they will try to determine whether you require a swab. Alternatively, those who worry that it might take a while, you can always try going for a swab in a private center. And from then onwards, even if you don't have symptoms, you're probably best to isolate for about 10 days. There are quite a few who are asymptomatic. We actually do an initial swab, and usually on day 9 of contact, we swab again to double check. Looking at sheer numbers, I can see we are being overwhelmed. We don't have any hospitals that is even 1,000-bedded government site, right? Simple math will tell you that we cannot take everyone in. Of course, they've opened up other centers as well, but these COVID-19 patients are on top of the regular patients that we need to see and take care of. Even doctors are human, right? They're worried that if they go back and see their family, they might give them the same disease, and they don't want that, hoping that this pandemic will be over soon. But unfortunately, it's been a year. Things have not only not improved, it has actually escalated, and I think it's not good for healthcare workers' morale. I've had to operate on patients who we didn't know the COVID status. So I have to be in that full suit. I did it for about 2-3 hours, and in the operating room, it's actually fully air conditioned. Usually I'm shivering inside the OT, but when I wore that, I could not feel the aircon at all, not even a slight breeze. The moment I removed it, I was completely wet. So imagine those frontliners who are doing this outside, there's no air condition, and it could be midday. No wind, no coolness of temperature. It's really, really hot. Just need to persevere in this race together as a nation, not so much of healthcare worker or just as Malaysians. I mean, even the vaccine, it's not a miracle drug. It's just going to slow things down a little bit. Every time we feel that we're going to give up and have that urge to go and meet someone or, spend time, we really need to ask ourselves, is it really necessary? Can this wait?